Taking temperature is important because an abnormal temperature can be an indication that the patient has a fever or an infection. Learning this skill can help you prevent an emergency for your loved one. To measure internal body temperature, you need a thermometer. Before taking temperature, firstly, the patient should not have eaten or drunk anything in the last 10 minutes because that will affect the temperature. Secondly, you must wash germs off the thermometer before taking temperature. Thirdly, you can either place the thermometer under the tongue or under the patient's armpit. You have to make sure the sensor is completely surrounded. Close the mouth or armpit and wait for a few minutes for a beep or the temperature to be measured. The normal temperature is between 36.5 to 37.5. If the patient's temperature is beyond this range, immediately call the nurse and do not panic. You also need to wash the thermometer with soap and water in between uses.
You check the temperature, right?
Yes, but I have to check thrice. Once in the morning, once in the afternoon, and then in the night.
Have you washed the thermometer?
Yes, I've washed it. It's been 10 minutes since you ate, right?
Yes, I have. Why?
I'm not supposed to take your temperature within 10 minutes of you eating or drinking anything. Lift your tongue. Now close your mouth. Keep the mouth closed or else it will change the reading. It's 38, slightly outside the normal range of 36.5 to 37.5. I'll still inform the doctor. What are the things you need to take care of before you take temperature? Temperature can only be taken if the patient hasn't eaten or drunk anything in the last 10 minutes because it changes the patient's temperature. Where should you measure your loved one's temperature? Place the thermometer underneath their tongue. Have them close their mouth and then wait a few minutes for the thermometer to beep. You can also keep it under the patient's armpit. What should you do with the number on the thermometer? Record the number on the thermometer on the Care Companion chart. What should you do if the temperature is outside of the normal temperature range of 36.5 to 37.5 degrees Celsius? Report it to a nurse right away. How do you keep the thermometer clean? Wash the thermometer with soap and water and store it in a box.